Hi, I'm Dr. Delia Garcia, and today I want to talk to the health professionals that are out there. Some of you may be new in practice, others of you may be close to retirement, maybe some of you are in the middle. You've been practicing for a number of years and you're feeling frustrated by your practice. Um, I'm an oncologist. I had a specialty in breast cancer for 30 years, and I left mainstream medicine 10 years ago to reinvent myself as a health coach. But what if you still absolutely love your practice and you'd like to help your patient population be able to achieve vibrant health and longevity? Because one of the things that I learned very quickly when I started practicing medicine in 1983, one of the things I learned very quickly is how many patients had diseases that were as a result of their diet and their lifestyle. And we know that in today's world, about 70% of all Americans are overweight, and half of those are obese. And so 70 to 80% of all of the medical problems that we see in healthcare today are related to diet and lifestyle, are related to being overweight and obese. And what are some of those conditions? The number one killer in the United States is heart disease. Over 600,000 people die of heart disease each and every year. And half of the people that experience a first heart attack will not live to experience a second. So it's a devastating disease, and it's very much related to overweight, obesity, our diet, and our lifestyle. We also have hypertension, we have diabetes, we have renal failure, and then a whole slew of cancers. Um, as an oncologist, again, every single day, I would see women in my practice that came in overweight, obese, some of them very young in their 20s and 30s with a diagnosis of cancer. And of course, we know that not all people with cancers that have a tie to overweight or obesity are as a result of that condition, but many of them are. Women who struggle with weight have higher circulating estrogen levels, and that's the precursor for breast cancer. So that's how I became interested in helping my patients achieve a healthy weight so that they didn't leave my office after chemotherapy, radiation, surgery, and then come back with a recurrence or a second cancer. I wanted to give them something more than those three modalities. I wanted them to have tools to be able to change their overall health and to live those vibrant, longer lives and be able to raise their own children because so many of them were young. What other cancers are related to being overweight or obese? Prostate cancer, colon and rectal cancer, pancreas, gallbladder, liver, uterine, ovarian. It's a huge laundry list of cancers related to excess weight and obesity. Um, and so what if you had a tool to be able to help your patients achieve that healthy weight and lower their risk of all of those things? And as they were losing the weight, maybe be able to ditch their medications for high cholesterol, for hypertension, get off their insulin. I mean, those are the things that we know can happen if people really concentrate on getting themselves healthy. And so, 15 years ago, I found a wonderful program, a lifestyle program, not a diet, but a lifestyle program that included weekly coaching. Doesn't take a lot of time, about 10 minutes a week to check in with your patient to make sure they're following the program. So weekly coaching, educational materials, weekly webinars, a weekly newsletter, a vibrant Facebook support page, all of these different tools in addition to a structured meal plan that would make it super easy for patients to begin losing weight and getting themselves healthier. But not only losing the weight, learning how to keep their weight off for life with all of these materials. And this program that I found is under the auspices of a publicly traded company that does all the heavy lifting, so that all we have to do is find the patients and explain the program, awaken them to the possibility of becoming healthier and changing the outcome of their health and well-being, maybe not only for themselves, but for their entire family. So we're looking for those people, and then we plug them in to this tried and true program. What if we had that? What if you had that tool, like I was able to find it 15 years ago, and then transition to full-time health coaching after I left medicine 10 years ago? And what if you had a tool like that that was able to, and you were able to create another income stream, a vibrant income stream, so that you didn't have to work so many hours? I know what it's like to be the breadwinner of my family. I was the breadwinner for all of the years that I was raising my 3 children, who are now young adults in their early 30s. So I know what it's like to rush out the door in the morning. Maybe the kids aren't even out of bed yet, and they have to get breakfast and get themselves to school. I know what it's like to be at the office long hours and then, run in the door at 7:30 or 8 o'clock p.m. And have very, very little time to spend with my children. I know what that's like. And I know the stresses of, not having enough time in the exam rooms, just rushing through the day and knowing that when you get home, you have children that have soccer practice or a swim meet or a hockey game, and they have to be fed as well. So many hardships on health professionals today. So again, what if you had a program that could help your patients create vibrant health and add years to their life, and you got paid well for it, so that you could maybe work 4 days a week or 3 days a week, or work shorter hours? Wouldn't that be wonderful? So talk to the person that shared this video with you, whether you're a physician, whether you're a chiropractor, whether you're a nurse practitioner, a nurse, a physical therapist. This is an amazing program that can help your patients get their lives back. I have one client. I call him a client because he wasn't a patient, but he had really severe heart disease, was told by his cardiologist that he needed to have bariatric surgery. The gentleman refused because he had friends who had bariatric surgery and had developed pretty severe complications. And so he reached out not to me specifically, but to another health coach that he met on Facebook. And she was able to help him lose 114 pounds in 8.5 months. And he was able to eliminate 14 prescription drugs out of 18. He eliminated 14 prescription drugs, and his prescription drug copays dropped from $1,100 a month. These were just the copays, to $25 a month, from $1,100 a month to $2,500 or to $25 a month. And he was able to come off disability. He got his life back. He's, has energy to burn. But those are the kinds of, that's one example of many. I have hundreds and hundreds of examples of people that have been able to change the trajectory of their life. So again, if you would like to hear more from me or from a person that shared this video, please reach back out. There's another life out there, a life that can give you more balance, more joy, and truly help our patients get their health back.